Hi everyone, my name's mdauk and today I am going to be presenting on Turner syndrome. So Turner syndrome is a chromosomal abnormality that only occurs in females. So what happens is one of the X chromosomes during cell division either becomes missing completely or partially missing. This abnormality in the X chromosome will cause a variety of medical and developmental problems for this child. And the onsets of signs and symptoms varies, along with the type of signs and symptoms varies as well in each individual. So working in a setting with patients who may have Turner syndrome, it's really important to be able to identify some of the main signs and symptoms that could indicate the patient or client having Turner syndrome. So at birth or infancy, slowed growth, a wide or web-like neck, a broad chest with widely spaced nipples, arms that turn outward at the elbows, and cardiac defects are really prominent signs that the child may have Turner syndrome. In childhood, adolescence, and adulthood, having a short stature and slowed growth. Again, slowed growth is a key component to Turner syndrome. Ovarian insufficiency and ovarian failure, which can cause delays of the development of secondary sex characteristics, possible mental health complications including learning disabilities, and specifically in adulthood, infertility is a major symptom of Turner syndrome. And just again, the big thing with Turner syndrome to look for is any abnormal growth development in females, especially around that time of puberty. One other quick side note, early menopause in young adults and in adulthood is another very prominent sign of Turner syndrome. So Turner syndrome is a genetic condition that, like I mentioned earlier, is caused from a missing X chromosome or a partially missing X chromosome during cell division when the sperm fertilizes the egg in utero. So because this is a congenital defect, it happens while the fetus is being developed. There are different genetic tests that can be completed prenatally to determine if the child will have Turner syndrome. So I'm just going to go over a few of those tests on this slide. I'd like to start by pointing out that I do have a prenatal ultrasound listed on this list. That is not a specific genetic test, but when doctors complete the ultrasound, they can look for signs and symptoms including edema on the back of the fetus's neck, any heart abnormalities, or abnormal kidneys. And if these are noticed, that might encourage parents to go forward with additional genetic testing when they may not have without the ultrasound. So if additional genetic testing is completed, one that can be done prenatally is the prenatal cell-free DNA screening. And this is a way for lab technicians, geneticists, to screen for chromosomal abnormalities in the developing fetus. And this is done by using a blood sample from the mother, and it just gets sent to the lab to look for any abnormalities in either of the X chromosomes. And again, these tests specific to Turner syndrome will only be completed if the fetus is female, because this syndrome cannot occur in male in males. The next genetic test, prenatal genetic test I have listed, is the chorionic villus sampling, and this is another chromosomal test that takes a piece of the tissue from the placenta, because the placenta contains the same genetic material as the fetus, and that tissue gets sent to a genetics lab, and again, chromosomal abnormalities are screened via the tissue. And the third prenatal genetic test that I have listed is amniocentesis, and this is where doctors will take fluid from the amniotic fluid in the uterus, and that fluid will be sent to the genetic lab to again be studied for any X chromosomal abnormalities. There are not as many options for genetic testing in childhood, adolescence, or adulthood, but individuals can do karyotyping, which is another lab that takes a blood sample from the individual, and again, it is used to ascertain a person's karyotype and look at those chromosomes like with the prenatal genetic testing. And in the picture that I have on this slide, it does show just a really simple visual of how the amniocentesis is done. So an interesting thing about Turner syndrome is, although it is a genetic syndrome, genetic disorder, there has not been a family history or an inheritance factor associated with this disorder. So basically, if someone's mom has it, there is no genetic influence that their sister or that their children will also have Turner syndrome. So it makes it hard to predict in a way if any grandchildren or any other children in the family, female children, will have Turner syndrome. Because the chromosomal mutation that occurs during cell division, it can be from either parents, and there's no way to regulate it. It's just an abnormality that happens that is out of everyone's control. There are, of course, exceptions to that. There are, in rare cases, a specific inherited type of Turner syndrome, and again, it's very rare, but it is always possible. So with the genogram that I have created on this slide, I just wanted to again reiterate how even if we have very healthy parents giving birth to a baby girl, it still doesn't really matter because it all comes down to that very scientific microbiology aspect of the developing fetus. So with this genogram, I have 3 different generations. So here's the first generation. These would be the grandparents. So right down here, this is the child that has Turner syndrome, as I have indicated by shading the circle a light purple. Then we come down to the second generation. So this is going to be the grandparents' children. So I have shown that they have a daughter and they have a son. And just to mix up the genogram a little bit, I included the daughter as having a heart disease, and then she is married to a man who does smoke. And as you can see, they have had 2 girls together. Neither of these children have Turner's because there is no inheritance factor to this disorder. Over here though, I have given the child's parents healthy genetics, and again, there's just no way to tell, there's no inheritance factor, so their child did end up getting Turner's, and it's just important to watch out for those signs and symptoms, to catch it early, to engage in proper treatment modalities for the child. So finally, when parents do hear or find out their child's diagnosis, it's really important to have education ready for them, information ready to provide the family. So the biggest thing with Turner syndrome is that continued care. So there are different specialists that women and girls will work with to help manage their symptoms. I just listed a few examples here: endocrinologists, gynecologists, geneticists, mental health providers, which is very important to help them work through any societal or anxiety, depression that may come from this diagnosis, developmental specialists and fertility specialists, specifically when the female is in adulthood, and if she does want to have children someday, working with a fertility specialist will be really important. Primary treatments that these women can go undertake include growth hormone, which is very common. The growth hormone is normally a daily injection, and it is recommended to go through this therapy because it helps increase heights and just helps that growing process that is delayed with Turner syndrome. Oxandrolone is another hormone, and this is kind of similar to growth hormone. It also helps increase heights and helps bones grow densely. And then estrogen therapy is really important to begin around 11 or 12 years old, because this is going to help promote the development of those female sex characteristics. And it is common that women with Turner syndrome will engage in estrogen therapy throughout their whole life. And also just really explaining to parents and the client or patient that they can have a wonderful life, that their quality of life does not have to be diminished, that with the proper treatment, that individual can live a full, independent, and healthy life. And here are my references. Thank you.